Hi, my name's Jillian, and in just a few months, I will be a family nurse practitioner. A nurse practitioner is an advanced practice nurse that is classified as a mid level provider. There are different types of tracks of NPs, including family, PD, adult geriatric, women's health, psych, mental health, and acute care. Within these specialties, you can also subspecialize, for example, in derm, neuro, cardiac, etc. The APRN consensus model is the NP regulations providing the scope of practice. NPs can diagnose, treat, and provide evidence based care to their patients. The scope of practice is determined on a state by state basis. For example, in Mass, NPs must practice in collaboration with a physician, where in New Hampshire, NPs have full independent practice authority. The difference between an NP and a PA is that an NP follows a patient care model focusing on disease prevention and health education, whereas a PA follows a disease centered model focusing on the biological and pathological components of healthcare. PAs tend to have a more generalized education but can specialize, and a PA cannot work independently in any states, although there is a growing push to allow them to do so. There are a few differences between an NP and a CNS, although they are both considered advanced practicing nurses. A CNS does not have prescriptive authority. A CNS is also looked at from both an individual level and a macro level, incorporating nursing diagnoses and management along with systems and synthesis of improved approaches of nursing care. A CNS is often seen in the role of a nurse educator. The difference between an NP and an MD is that an MD must go to a certified medical school. The model of education for MDs is a medical model focusing on biologic and pathological components, as previously mentioned when discussing PAs. The PA program tends to follow that of the MD. MDs have independent prescriptive and practice authorities in all 50 states. I get the question a lot that if you're already in school for 3 more years, why didn't you just become a doctor? Before choosing a career path, I was torn between MD, PA, and NP. For a long time, I was set on either MD or PA. Following my bachelor's degree in neuroscience, I took some time off to figure it all out. In that time, I worked as a nursing assistant at Beth Israel. When it came to piecing together what I really wanted, I quickly realized a few things about myself. The first thing was that my own quality of life was extremely important to me, and I did not want to go to medical school and be in school for many more years. I wanted to get married, buy a house, and have kids, all within my so called 5 year plan. But more importantly, I fell madly in love with nursing, the nursing model of care, and the person that it made me. The medical model had just seemed to lose all of its appeal to me. After doing some research, I realized this world was the one for me, and I couldn't be happier with my decision to do so.